bucks at this podium because that's about what it costs in orthopedic surgery, so I'd be able to stand before you tonight. It's an honor to be here among people who have not only studied tick-borne disease, but stood with those of us who are living with it. My name is Meghan Bradshaw, and I serve as the Government Relations Manager at Center for Lyme Action. But long before I ever walked the halls of Congress, I was a patient. In 2019, I was living in Nashville, thriving in a career at Nordstrom, mentoring teams, chasing goals, running on caffeine and purpose. I thought that I had my life mapped out. Then a simple knee injury sent me home to North Carolina for what was supposed to be a quick 2 to 3 week medical leave to repair a torn meniscus. 3 weeks became 3 months, and 3 months turned into 3 years. I went from being a fast-paced leader to being bedridden, from running multi-million-dollar businesses and dynamic teams to not being able to lift a fork. At the prime age of 26, I underwent bilateral hip replacement surgery, and the very next morning, an email arrived confirming my tick-borne disease diagnosis. I finally understood what had been wreaking havoc on my bodies for the years leading up to this. This diagnosis answered everything and explained nothing all at once. I had been misdiagnosed for years with an autoimmune disease, treated with immunosuppressants, and by the time we understand what was really going on, the damage was done. Since then, I have had 10 total joint replacement surgeries and 8 joints surgically fused. But I always say it's not that my infections were so severe, it's that I was misdiagnosed for years. I was treated incorrectly, and that accelerated the progression of my disease. My story isn't rare, it's simply what happens when patients slip through the cracks of a broken system. Piece by piece, my body was being rebuilt, and it became almost a badge of survival, a reminder of how much this disease can take, but also how much we can overcome. So yes, I'm the bionic woman, but I would not recommend this path to get here. For a long time, my world shrank to 4 walls, surgery recoveries, and an IV pole. At my worst, my functional level was comparable to someone with a spinal cord injury, and my fine motor skills comparable to those of a toddler. I lost my independence, my confidence, and at times my will to fight. I don't believe that one can know a grief more profound than being trapped in a body that can no longer carry out what your heart and your mind intend to do. I spent hours upon hours every day for months sobbing and grieving the life that I had intended for myself, and I constantly said, I can't do this anymore. But somewhere along the line, I realized that I needed to master acceptance. I remember thinking, if this is as good as it gets, how am I going to make the most of it? When I couldn't strengthen my body, I decided to strengthen my mind. I went back to school for my master's in public health at UNC Chapel Hill, and I participated in the 2022 HHS Federal Tick-borne Disease Working Group. I learned about systems, policy, and how change actually happens. I was joining advocacy meetings from my hospital bed, and as you can imagine, I was quite the lively participant in these meetings due to my pain regimen. Although my body was being rebuilt with cobalt, steel, and titanium, my spirit was hanging by a thread. And after about a month in the hospital following complications of bilateral knee replacements, I returned home, and it was on that drive I realized how much time had passed while I was sitting still. I was deeply traumatized and severely depressed. And when my cries went from, I can't do this anymore, to I don't want to do this anymore, this work became my North Star. It was the reason I kept going, because I wanted to see these things through. It's hard to convey just how stuck I was and how limited I became. I watched an orchid bloom in real time before my eyes. I watched the trees in my parents' backyard turn red, become barren, and bloom again in the spring 3 times over. But during this time, I found my way back to the classroom, to Center for Lyme Action, and thankfully I eventually found my purpose. During this time, I also began telling my story, and I was honored to be featured by some of the organizations that I work with, but also international media platforms like Today, WebMD, and even the Daily Mail. I've been referred to as one of the worst cases of tick-borne illness, but that's simply not true. I recognize how fortunate I am to have had the means to improve my condition, and that I have the opportunity to live a full and meaningful life. And this is why I'm passionate about working towards a world in which healthcare is equitable and just, because every patient deserves that opportunity. Now, here is where the story comes full circle. So for years, I traveled to Washington, D.C. for medical treatments with my ILADS doctor. I was desperate for answers, for a little hope and a sign that my life was going to look normal again. But now my trips to Washington look much different. I no longer go for treatment, but I go to walk the halls of Congress, and I sit across from senators and representatives, not as a patient looking for answers, but as an advocate demanding action. At Center for Lyme Action, I help to lead our advocacy efforts in a network of over 10,000 patients, providers, family members, and other supporters from all 50 states, DC, and Puerto Rico. This reminds me that this fight is not about statistics, it's not about abstract policy, it is about restoring futures. Together, we are doing something that is truly remarkable. Since our founding in 2019, we have helped to grow federal funding for Lyme and tick-borne diseases by more than $500 million. $500 million. And that's not just numbers on papers, that's research grants that are awarded, prevention programs that are expanded, and real hope for the families who've been fighting in the dark. And yet we know that this is just the beginning. This week, we observed World Mental Health Day and Pandas Awareness Day. And tonight, I'm especially proud to share that we're starting a new initiative at Center for Lyme Action to focus on infection-associated neuropsychiatric conditions, including Lyme, Bartonella, PANS, and Pandas. This initiative will unite researchers, clinicians, and policymakers to confront how infections can trigger profound neurological and psychiatric symptoms, and to ensure that patients are seen, treated, and believed across disciplines. Because too many people are suffering in silence. They're caught between infectious disease and mental health systems that do not speak the same language. We can and we must change that. One of the greatest lessons that I've learned is that healing doesn't always mean being cured. Sometimes healing means that we're reclaiming a little bit of what's been taken from us. I've seen what happens when science meets storytelling, when data meets determination, and when patients and providers walk this road together. That is where the real progress lives, in partnership. Our fight is far from over, and we need sustained federal funding that matches the human toll of these diseases. We need you to join us in this fight. Every one of us in this room holds a piece of this solution, and together we're going to be unstoppable. I used to think that my illness had taken everything from me, but now I see it also gave me something. Clarity. Clarity about what matters, clarity about who I am, and clarity about why I'm still here. Because I want to help make sure that no one else loses years, livelihoods, or lives due to these insidious diseases. That's my why. So from one titanium-filled advocate to a room full of heroes, thank you. Thank you for your research. Thank you for your compassion. Thank you for your refusal to give up on patients like me. Because when we show up together in clinics and in the halls of Congress, we are not just changing policy, we are changing lives. The day will come where tick-borne diseases no longer mean tragedy, but triumph. And when that day arrives, we'll know it was because of all of you. Fortunately or unfortunately, I am running out of body parts to donate to help move this cause forward. So I am humbly asking for your help. I know you do not have to give a body part, money will do. So thank you for helping me and so many others who are in this fight to take a stand.